Hello, folks. This is the PT on Ice Daily Show brought to you by the lovely folks at the Institute of Clinical Excellence. My name is Dustin Jones. I teach modern management of the older adult with my partner in crime, Christina Previtt. Today is Wednesday, so that means it's Jerry on Ice, where we talk about all things involving older adults. So we recently did a course in Casper, Wyoming with the amazing group of clinicians out there at Wind City Physical Therapy. And I was just reflecting on that amazing weekend, and one of many themes that came up was some of the subtle differences that we see in Jerry PT as opposed to, let's say, some of your other folks that you're going to be seeing in outpatient ortho, maybe that 65 and younger crowd. What are the differences that we have to consider in every step of the process from that initial interaction all the way to discharge? And we start the weekend in our course talking about the evaluation process. Actually coined the process. Jeff Moore talks about this and kind of takes people through how we want to think about our evaluations and even all the subtle nuances in terms of the words that we use, how we communicate, what we do first, what we do last. A very, very thoughtful approach to that first interaction with our patients. And I wanted to bring up some things that may be a little bit different in the Jerry PT world and things that maybe you may be missing. I know I can speak for myself that when I was practicing in outpatient ortho, I'm in home health now, but a lot of these things I was not paying much attention to. I didn't necessarily see how important it was to the quality of life of a lot of my patients. But now that I'm spending more time in people's homes and seeing how different factors impact their quality of life, I'm thinking differently about some of these things. So we're going to go through 5 things that you may be missing in your Jerry PT evaluation. So the first one, it's a big one, is fear. Are you talking about fear with your patients? Are you asking them questions? Are you even running them through a particular questionnaire that you could use, like the Activity-Specific Balance Confidence Scale or the ABC scale, or the Falls Efficacy Scale, the FES? Fear, especially in older adults, has a big impact on performance, on balance capacity, on people's abilities to take in the environment, to process that information, and then provide a motor output that's going to do the thing that they want to do. Fear can impact the quality of that experience. It can also impact people's decisions on what they may try to do or may not try to do. Whether they try and get outside and go for a walk. Fear could be the limiting factor, not their physical capacity, but the fear. So this is something that we should be addressing, and you're starting to see that more and more in the research in terms of how can we address fear. Cognitive behavioral therapy is a pretty common intervention that's pretty well researched, but now we're starting to look at combinations of cognitive behavioral therapy along with graded exercise and how we can actually reduce fear levels, and we talk a lot about that in the course. But for you all, for today's purposes, I just want you to start thinking about getting an idea of fear that may be involved with different activities. And there's 2 options that you can use that I would recommend. One is the ABC scale. So I mentioned that before, the Activity-Specific Balance Confidence Scale. It's 16 questions, and you basically have 0 to 100% of how confident you are with these different functional tasks. And you can gauge, what people are fearful of, and that can help inform some of your interventions or the conversation that you have with that person in the evaluation. Another one is a little shorter, and probably more commonly used from what I'm seeing is the Falls Efficacy Scale, so the FES. That's only 10 questions, 0 to 10 or 1 to 10 in terms of how confident they are for those particular activities, and they're just some common tasks. And this can be give you a very, very helpful information in terms of what you may want to work on, but you can also gauge progress as well by performing that FES or the ABC scale in a month or at discharge, just to see where people are. So fear, acknowledge it, address it, try and measure it, and you can actually intervene and reduce fear. So that's something that's going to impact the quality of life of your patients. So 1, fear. 2 is falls risk. Talked about this a lot on the podcast. If you've been listening for any period of time, falls is something that is very common in the Jerry PT world. We talk about it a lot. It's very, very common. It's very, very significant. Impacts many of our patients, and can really be kind of an incident that could lead to many negative sequelae afterwards, and may potentially a lower quality of life. So we want to see who is at a high risk for falling, especially for you all in the outpatient ortho world that may be able to intervene or capture these people before they end up needing my services when they're homebound adults. So a great way that you can measure falls risk and identify people that are at risk is the study. So that's provided by the CDC. I'll put a link to another PT on Ice that I did that kind of walked through the study. Very, very helpful, very quick. You could potentially run the study with some of your front office staff, or you could do this during the initial evaluation. But this will really help you triage, what is most important. That person may be coming to you for low back pain, but they also may be at a very high risk of falling, which is something that you want to be addressing as well, along with that low back pain. Okay, so fear, falls risk, and the third one is polypharmacy. This kind of goes in with falls risk as well. But medications, we got to be looking at medications, folks, especially if you are working with a population that may have some medical complexity, a pretty long laundry list of that medical history, or, if they are, considered an older adult, they likely have some medications that they are taking and likely are taking 4 or more. If they are taking 4 or more, that's a red flag to where you want to look at that list, see what they are. But more importantly, you want to look at what they're taking. 4 or more, it would equate to polypharmacy, and that does increase risk of falling. But as we're looking more and more at how medications impact performance, there's some select few medications that have a big impact that we really want to make sure that they're achieving their therapeutic purpose. And there's more to gain than to lose when we take these particular medications. I'm going to go through a few kind of families just so you have them on your radar. I'm going to link to the Beers criteria. They just published the updated version of that, and that's going to be a nice, you can get a pocket version that you can scroll through and see, okay, this medication, is probably inappropriate to use with, older adults. But something like drugs.com or some of those online checkers are helpful as well. So some things to keep an eye out for are loop diuretics. So this will be, your Lasix. But what you want to look for is if that medication, not the generic name, but the actual name ends with IDE. So for furosemide or furosemide, I'm going to butcher these pronunciations, is Lasix. So that IDE will tell you that's a loop diuretic. That can put people at risk for orthostatic hypotension whenever their blood pressure doesn't maintain that pressure whenever they change positions. It could lead to them potentially fainting and falling. So loop diuretics are something that you want to be aware of. IDE. Beta blockers, very common with people that have hypertension, for example, but OLOL is what you want to look for. So metoprolol is a pretty common one, but that can lead to orthostatic hypotension as well, which can be very common with a lot of our folks. So IDE are the loop diuretics. OLOL is the beta blocker. And then the last kind of family that I really want to mention are the psychotropics. They affect, the central nervous system. They can impact, reaction timing, especially, balance, reactive stepping, a lot of those things, which has an impact on someone's balance capacity and their risk of falling. So when you're looking for that, Prozac is probably one of the more common ones, but what you want to look for is medications ending in INE. So INE, you want to also look for ending in PAM or LAM. So like Valium or diazepam, that PAM or LAM will also show you that is a psychotropic that is impacting that central nervous system in some way, shape, or form. So those are some ones that you kind of want to have in your brain, but I would recommend running, some of these medications through, one of those websites or Hippocrates or an app or something along those lines, especially in older adults. Very, very important. Not fun. I hate medications. I don't like learning about them, but they're important. So we should, give it its due diligence. All right. So we have fear. We have falls risk. We have polypharmacy. Number 4 is a functional Asterix sign. So I know many of y'all, when you're doing that initial evaluation, you're trying to find that Asterix sign, that particular movement that is, recreating that person's chief complaint or their chief symptom. And you're going to probably do a treat, test that Asterix sign, and then see, kind of how you have been able to impact that person's chief complaint. You're helping build the bike, being able to show a tangible difference or change in how you were able to help that person. That is something that I'm not advocating against that whatsoever. That is something that you definitely want to be focused on. But with older adults, sometimes pain may not be the biggest thing on board. It may not be the biggest limiting factor. So yes, if they are complaining of that low back pain, gather that Asterix sign, do your treatment, test, retest, see if you are being effective in creating change for that person. But we also want to look beyond pain and see, are there particular things that they're having trouble doing that greatly impact their ability to move throughout their home or through their environment? Is there something that's related to function that you can make a very quick change? So a couple examples that are very common in my world in home health. Let's say the ability to get up off of a toilet or their recliner. Sometimes it's just a matter of positioning, leveraging momentum, upper extremity placement, of just setup that could really allow someone to come up out of a chair much, much easier. That could have a big impact on their quality of life if that is something that they're concerned about. Another one is a magic trick in the home health world is when someone, lives in an older home with narrower doorways and they have a tough time getting through some of their doorways. So they have to leave their walker in the hallway or kind of do the side, shimmy shuffle into the bathroom, for example. You can take on a regular wheeled walker where the wheels are typically on the outside of the frame. You can take the legs and switch them so the wheels are on the inside of the frame, which gives you, an inch and a half, couple inches more clearance on either side that can allow them to get to some of those tighter spaces. Things like that. How can you create quick change to improve people's ability to interact with their world, improve their function? It may not be pain related. So look beyond the pain. Functional Asterix signs is something you want to look at. The ABC or the FES scale can oftentimes kind of guide you or let you zone in on particular activities that people are not confident in or worried about. That can often tell you or, kind of guide you to say, okay, let me look at this and think how I can improve this today to build the bike and really get that therapeutic alliance and buy-in. Okay, fear, falls risk, polypharmacy, functional Asterix signs, and the last one is triaging. You all are so good at really identifying, what is contributing to someone's pain. What is the issue? I'm going to address that and, get them out of pain, improve their function. You all are the best at that in the outpatient ortho world. But I want you to really think about triaging in the sense of, let's say someone has come to you with, some type of shoulder pathology after a recent fall. So yes, you're going to address the shoulder, obviously, but we have to think about, what caused that fall. So let's say you go through your evaluation and you're doing, a balance assessment. You notice that they don't have a great hip strategy to maintain their balance. And then, you start to talk to them a little more and you find out that, whenever they go from sitting at the edge of their bed to laying down, or when they're laying down to coming up to the edge of their bed, the room starts to spin a little bit. Just kind of gives you the red flag. There may be some vestibular involvement. But then you go through their medication list and, they're on Lasix. They're on that loop diuretic that we know causes orthostatic hypotension that, can lead to a particular fall. And then you go down the rabbit hole some more and find out they haven't, had an eye prescription or glass prescription update for over 5 years. And they have a poorly lit house. So their vision is impaired. And you can see that right in front of you, when you're taking them through the outpatient clinic. So even right there, we've named probably 5 different factors that likely contributed to that fall, but they're there for shoulder pain. What in the world do you do? We need to think about what is the big driver. What are some of the things that we can make a big difference on? So it may be addressing all of them. It may be, trying to improve that hip strategy. We're working on their shoulder pain. We're going to, clear the vestibular system, maybe call their primary care physician about Lasix to see, if this is still an appropriate dosage and, check an orthostatic hypotension to see if that is a culprit and report that to the primary care physician and maybe refer to get their eyes tested and get their glasses updated. That's how we have to think about these patients. Look beyond their pain, look beyond their shoulder and see what are big factors that are contributing to a decreased quality of life. Now, I know that may take time. It takes a lot of conversations. You may have to pull in some family members or caregivers, but you're not serving your patient well if all you're focused on is that shoulder that is causing pain. So I want you all to think about that. What is that triage list of how you can really make a big impact on those people? Because it's likely more than just focusing on a particular body part or a particular muscle. We have to think really big with these people. So to wrap it up, fear, falls risk, polypharmacy, functional Asterix signs, and really focusing on triage. Those are 5 things that you may be missing in your Jerry PT eval, particularly in the outpatient ortho setting. If you all have other things that you can think of that you are tracking now that you are seeing has a big impact in the quality of life of your patients, but you may not have been doing, way back when, put a comment in the video below. It'd be interesting to get some dialogue of some other things that we really need to consider in the world of Jerry PT. So I hope that was helpful. Those are mainly learned from mistakes on my part, from going to outpatient ortho to home health and just kind of seeing what I was missing, when I was in that home health setting. So thank you all for listening to this. Wanted to give a quick announcement about Virtual ICE. So this is our mentorship, online mentorship program. Every single Tuesday evening at 8 p.m. Eastern Standard Time, one of the ICE faculty gets on and talks about a particular topic that they care about or are an expert in. Every single Tuesday evening, we record it. We put it in a private group so you can watch it whenever you want. It's also approved for CEUs, but I would highly encourage you all to check that out. So you can find that on ptonice.com. Scroll down. There's going to be a tab for Virtual ICE or VICE, but that is an absolute steal, $29.99 a month, and it's also approved for continuing ed. Also, check out the Modern Management of the Older Adult course. Our online course is rocking and rolling. We've got several live courses throughout the country this year. So that course is also at ptonice.com. Appreciate y'all, and I will talk to you next week.